afternoon. My name is Cathy Novicky, and I am coming to you live Facebook, doing my 90-day Facebook challenge for Champions Over Cancer. Today is day number 21, and it's hard to believe that it really has been 3 weeks since I've started this challenge. In some ways, it seems to have gone like that, just like, you know, your weeks go by and you realize, you know, it's, wow, it was the end of May and now it's, you know, the middle of June. But in other ways, when I always love it when I finish a Facebook Live, because I think I get really pumped up and I think, yes, it's done for the day, and I did it another day, and I like really doing it in the afternoon because I don't like having to come home when I work, and especially if I'm late and I have to do it like at 10 or 11 o'clock at night, or I'm just not, you know, procrastinating, which I'm very good at, and I totally admit that. So when I do them in the afternoon and they get done, I'm very, very happy. But today actually is another, there is another significance to this day, which I didn't realize until I was putting together my thoughts. Today is June 15th, and today is exactly 7 years from when I had my bilateral mastectomies. And you know, when you are told that you have breast cancer, when they give you the diagnosis, that's one thing. You know, you get blown away. Time stops. You're just in this bubble, and you know, all you're thinking about is, oh my God, you know, what's going to happen, and all these thoughts. But it's still, I don't want to say it's not real, because it is, but it's surreal, because you feel, I felt, the day I was diagnosed with breast cancer, I felt the best I had since before I had children. I was exercising every day. I had lost weight, and if you told me I was sick, you know, 24 hours prior to me finding my lump, I would have been like, ah, you're crazy. I feel great. But the day you have surgery, it becomes very real. I remember, and you have to remember that as a healthcare professional, I am at the bedside a lot. So when I talk about being on the other side of the bed rail as a patient, it's not to diminish anyone else's experience, but you know, for me, it was very interesting because I got to see the other side, and I hope no one ever has to do that. I know that's probably a wish that will never happen, but you know, you pick as a professional, and then getting put in that environment, I knew rolling down that hallway that things would be different. That morning I was the second case, and where they prepped you, they had to move me because they were starting to get post-ops out. And so what they did was they put me in the PACU area, and they put the stretcher right across from the kitchenette. Now you might think, what's the big deal about that? Well, first of all, I had not eaten anything since midnight the night before, And secondly, they were brewing a fresh pot of coffee. Now, if you know anyone in healthcare, and nurses in particular, you know that we inhale coffee. If we could have it intravenously, we would. It is something that sustains you, and there's none of that brown water stuff. I go for high tests. You know, if I'm going to Dunkin' Donuts, I'm getting dark roast with a turbo shot. And so I'm laying there and I'm smelling this coffee, and it was, I'm sure they had no, you know, it was something they didn't even think of, but I thought, this is just a little sadistic torture. And then, you know, you say goodbye to your family, and you just know that when you see them again, things will be different. When they wheel you into the OR and you get onto the table, I can remember that the nurses and the scrub techs were all very, very supportive. And it was, if you can have a good experience, you know, going to the OR to have your breasts removed, I would say that it was. But I can remember that as I was going under anesthesia, that when I woke up, I would be different, and everyone else in that room would still be the same. And that's the beginning of, it's, you know, it sounds corny, the beginning of the rest of your life, but it is, because from at that point it is very real. You wake up with bandages, you wake up with drains, you wake up feeling groggy from the anesthesia, and depending on, you know, what you have and pain tolerance, you have, you know, you're uncomfortable, and then you experience post-op, you know, the post-operative period where you run into other other things, and for me it was other how shall I put it, other situations that were kind of interesting, being a nurse. And I know I've taken care of healthcare professionals, and there's always a, you know, a doubt, a question. Do I tell them I'm in healthcare, or would I rather them not know? Because it's, you know, it just changes the dynamic. And so I guess they knew. I don't remember, but I can remember being on. It was a large hospital, and they had one floor dedicated to women's female gynecological surgery. So it was a very specific floor, and I can remember lying in bed on the second post-op night and hearing what's called a PCA machine. It stands for percutaneous anesthesia, but it's pain medicine that you hit the button, and you know, to give yourself something for pain. And the theory being that you don't have to wait for a nurse to go and get the medication and bring it back to you, yada yada. And I did not have that, but it, you know, it all depends on the physician and you know, how they order things. And I was okay. I mean, not that I was hoping for that, but I can remember laying on in the bed, and they were very, very busy. They were getting fresh post-ops at 10:30 at night, which is outrageous. And there was a PCA machine going off. It was empty and it was beeping. And it's the same PCA machine that we use where I work. And it went on for a half an hour. And I thought to myself, I could go and, you know, get the keys from the, you know, if they still had, you know, carried keys, and I could probably replace that and stop the beeping, and that poor person wouldn't have to listen to that thing going off for 30 minutes. It's just, you know, the realities of a shift. And and it all came back to me when I looked at the date today. And also of note, which is, I guess, dating myself, but it is what it is. June 15th is also the day that I graduated from high school. And on that day in 2010, it was 30 years from when I had graduated from high school. Now, when you're a senior in high school and you're graduating and you're, planning your future, I've talked about this, about the past and this moment being the present. And when I'm done with this Facebook, it will be in the past already. But you're thinking about the future when you've been diagnosed, and when you've gone to the OR, you wake up and your reality and your future is much different. And I forgot what I was going to say. But oh yeah, high school. And who would have known that? Well, nobody would know, but 30 years to that date, I would be having the surgery, and there's no breast cancer in my family until I got it, and my genetic markers were negative. No one had ovarian cancer, breast cancer in my family. So, they tell you that, when the campaigns for awareness and self-check and all that if you have a direct, what do they call it, a first generation or a first direct relative, that, like your mother or a sister that has had breast cancer, that your chances are higher, your percentage of probability that you come down with it are higher than than someone that doesn't have a history in their family. And well, along the way, I found out that there's a lot of things that you hear that really aren't completely factual. That I don't remember the percentages, and I'll that's my fault that I didn't look that up. But the family history piece is not as big as they make it out to be. Whether that's because people are more aware, and so they are more, I don't want to say more diligent, but they are more proactive in getting checked, perhaps having intervention. I don't know, but that was an interesting fact that I came to know, and a title that I inadvertently was given. I am the creator of a history of breast cancer in my family without positive genetic testing, and who knows, there is no why I got it. They can speculate, but I'll never really know. So when I sit down and I start putting bullet points on paper, and I realize that it's been 7 years from the day I had my mastectomies, it kind of hit me, and that, past and your present, and then thinking of your future kind of came in, because when you're first diagnosed, that's all you think of. Every other second, it's in your head to some degree. And then when you have surgery, it's, you can't get away from it. It's there, it's done, and things usually rapidly progress from there, depending on your staging and your, what you need for further treatment. And when you're going through acute treatment, I had chemotherapy. I had 8 rounds of chemotherapy, and I had a every other week schedule, and I think I had one extended a third week because I needed a little more time to recover. So, you think, oh, 8 treatments, it's not that bad. But it was almost close to 5 months when you, do you know why she hasn't been answering my messages? Hi, Melanie. I'll be on that call at 4 o'clock. So for hello. So 4 or 8 treatments turned into close to 5 months of toxins being. Hi, Mel. 5 months of toxins being poured into your body, and with each round, it's cumulative. With each round, you become sicker and sicker. I did, and so. I'll be on that call at 4 o'clock. So thank you so much, Cass. Sorry. So I think it was there were 3 drugs that I got. I got adriamycin, Cytoxan, and for 4 weeks, and then I got Taxol for 4 weeks. And towards the first adriamycin and Cytoxan were the first 4 treatments. And between my 3rd and my 4th treatment, I actually I had to have that 3rd week of rest because I had complications from it. I was anemic. I was severely dehydrated, and my heart rate was sitting at a comfortable 160 to 170 beats per minute. So it was good to know that I had nice clean coronary arteries because I didn't have any chest pain, which I was very happy for. But walking up a flight of stairs, I would get so winded that it gave the statement I had to sit down, otherwise I was going down. It gave it new meaning. And I didn't feel like my heart was racing, but I just felt like crap. And it was interesting because the nurse, the breast navigator that helped me tremendously, and I love her to this day. I went into the hospital because I had to go to a meeting, and I did not want to miss this meeting. So she said, come to my office and we'll go down together. And I walked into her office and she looked at me and she said, you look like shit. And I was like, thanks, that's just how I feel. But, we had known each other long enough that I wasn't insulted by that. And she, took the initiative and called, I almost said my obstetrician, that wouldn't be correct, my oncologist, and said, you need to see her today because something's wrong. And they did, and they ran a bunch of tests that were negative, and then they hooked me up to a machine called a pulse oximeter. It's a little clip that they put on your finger, and it reads the oxygen percentage through your fingernail, that takes and looks at the number of red blood cells and how much oxygen that they're carrying. And they trotted me around oncology, and my heart rate, was up in the 170s, and my pulse ox, my saturation was in the mid 80s, which for someone who's healthy, and has no respiratory disease, usually your oxygen saturation is 97 to 100%. So I was significantly compromised, and it could have been worse. I totally accept that, and I was very glad because the worst part would have landed me as an inpatient, and that didn't happen. But I needed I needed intravenous fluid, so I got half that afternoon or early evening, and then the next day I had to come back for the other half, and it put off my next round of chemo for another week. And then the Taxol, the complications with Taxol that you get is neuropathy. And you hear people say things like, I was dropping everything. Well, it's true. I couldn't even button my own shirts. My fingers weren't working. And hold a pen to write, forget it. And I have some left leg neuropathy from a congenital back issue that I have. That's a known, and so they always check your your sensation before they're giving you your dose of Taxol. And my last dose, they take I'm sure you've seen them. They do the pin and the feather, and you've got to differentiate from sharp and soft. Well, that was no problem. But then they do this thing, and it's with a tine, the test where they hit the thing and they put it on a bony prominence, like like your wrist where your bone sticks out, that sort of thing. Well, they tap this thing and they put it on my ankle bone, and it's a vibration that you're supposed to feel. And they tapped it, put it on my ankle bone, and I couldn't feel it at all. So they went, oh, okay. And they changed the dose of the dose of Taxol. And those things can, the side effects of chemotherapy don't necessarily always go away. Now, mine luckily did. It's my left leg, it's still very intermittent, but some people can have long-term effects from chemotherapy that don't resolve. And then there are long-term effects of chemotherapy 10, 20, 30 years down the road. And and we're talking into the future. And like I said, you plan for your future because you hope you're going to be there, but there's no guarantee. And so when people start having complications from chemotherapy, 20 years down the road, it's like, well, where did that come from? Because they don't really know who's gonna have complications. What kind of chemotherapy did you have? Where did you have it? And then you add radiation into it. So radiation was very interesting for me. I work in the same hospital, but I'd never been into that area, and I'll call it the bowels of the wing, because you're literally behind, I don't know, a foot of lead that's around that whole room, that whole department. And they had just gotten, what's it called now? A linear, radiation linear device, and it was the latest and greatest at the time. And you have to, they position you, and for me, I had to have my arm over my head, and my head like turned this way. And then what they do is they have this, it's a pad or something. They have it underneath you, and once they get you into that specific position, they activate it, and it forms around you, so that every single radiation treatment after that, you are in the exact same position, because obviously of the importance of the radiation. They want to make sure that they're hitting the right spot, and they're not hitting anything that's normal. So that was lots of fun, because they didn't tell me that this phase, this what do they call it? This marking, they're working out the slices and all the mathematical computations and everything. And okay, fine, it's going to take a while. Well, 45 minutes into it, and I was in tears. And I think for treatment, it was the first time that I had cried because I was in so much pain. And that got a lot of attention. And they were all in there, and they said, well, they gave me a break from that position. They said, so you could take your arm down. I said, I can't move my arm. They literally had to move it for me. And that is one of the limitations I have. I have very good, range of motion from my surgeries and from the radiation, but I cannot have my arm over my head for any length of time, which it makes Jay very, very happy because it limits my ability to shop. But it can be very limiting. So here I am. They've got this new linear accelerator. Maybe that's it. And I'm 45 minutes into it, and they say, the computer, froze. And we have an engineer coming to look at it. And they said, so do you have like errands to run or something? You can't, and you couldn't come back. And I was like, well, yeah, I need to do a few things, thinking, great. So I ran out and I did what I needed to do, and I came back, and they said, what they didn't tell me was that they had to run it. They had to run the whole program again from the beginning. So, and they offered to wait till the next day and do it, and then give me my first round of radiation. And I was like, no way. You're going to finish this today, and, I'm not leaving until it's done. So, and there was a lot of, on my part, there was a lot more sarcastic comments, because that's just how I deal with things. But at one point, you have to do this and you have to do that and blah blah blah, and so they're all in this other room, a viewing room. They can see me, but they're not talking to me. So the second round, they're talking to me because I'm like, I don't even know what's going on. Will you people talk to me? And so they started talking to me, and after they gave me several rapid directions, I went, do you want me to roll over like a dog too? And they kind of looked, they looked at me afterwards, and they thought I was serious. And I was, yeah. So I left, as I call it, the glow department, and we got off to a bang. Yeah, we really bonded that day. And I had 28 radiation treatments on Monday through Friday, of course. And that went through December 31st was my last radiation treatment. And the radiation treatments are just getting the treatment is really easy. It's not, you lay there in the position for 15 minutes and you get this rads pumped into the tattooed area. I forgot to mention that. They take a needle, which was one that I myself used upstairs, but it was just to draw up medications because it was a very large circumference needle, and they take this and they pop it into your skin at certain points, and then they put a drop of ink, like a tattoo. They drop a drop of ink into the needle, and it just, goes into your skin. Well, they did this before they start mapping, so that they have points of reference, so they can, start getting the exact angles. Well, it would have been nice to have known that that was going to happen, because they just did it, and I was like, ow, what's that? So this is all things that I am seeing from the other side of the bed rail, and usually it's, you tell people you're going to do something, and I am not a big proponent of tattoos. Trust me, some of them are works of art, but you know, I've seen 80-year-old ladies that have tattoos, and it's not pretty. But irregardless, that was done, and over the 28 days, those girls became the radiation ladies. We developed quite a bond, and they're wonderful people, and we just got off to a really bad start. But so yeah, that's where I got my glow from, and you know, so when you look back, when I was getting marked that first time, was I thinking into the future? 7 years? I don't think so. I was just trying to get through the moment, get through that time, and you know, when you're done with acute therapy, that was the end of December, and I went back to work in 10 weeks, and you know, you start your hair is starting to grow back, and you're not as fatigued, but people, you know, oh, your treatment is over, and yeah, you know, life goes on, and life is going on. People, you know, are living, doing the things they do, and you know, they, for whatever reason, they might forget or think that you feel all fine and good again, and you know, life is good. But it takes you a while. I can remember our daughter graduating from college in late May or early June, and we had to walk up this hill to get to the arena where the graduation was, and my son and husband were like 100 yards ahead of me, and they had, you know, they were oblivious to the fact that I was way behind them, because I was only walking as fast as I could. So those are, you know, the little things that I picked up on, and you know, it's, I don't know that if you've not ever gone through it, you would pick up on it. But irregardless, so it's you know, June 15th is quite a significant day for me in many ways, and now it's been 7 years, and the future. I mean, okay, this is the now, but 7 years ago it was my future, and I didn't know what I would be doing, and I have just, you know, if you told me 6 months ago that I would be doing this 90-day live to reach out and to start a conversation about the culture of, you know, being cancer-free, I would have been like, what are you talking about? But, you know, it's the consistency and the number of days in a row. I'm beginning to understand why that is the recommendation, because you start, people, for whatever reason, whether someone they know has read and you know, liked my post, and one of their friends happens, you know, is on their wall, or what, you know, I'm not that technologically savvy, and it becomes a catalyst. And yesterday, when I was on live, my daughter's high school basketball coach clicked on, and it was like, oh my God, I haven't, you know, we haven't heard from him in forever, and I was like, Devin, thanks. And he shared, you know, he shared the page, and that was great. And we have double-digit increase in the number of people that are, you know, have have joined the page, my Champions Over Cancer page, and I'm starting to hear more and more. I think it was yesterday that I was talking about at the survivorship celebration last week. The mayor called it thrive. That he never mentioned the word survivor. He called it that we who have become cancer-free or in remission are thriving. So that conversation is starting to take hold, not only just with me, but in other people. And there are 13 million cancer-free patients in the United States. So obviously there are other people that think like I do and are talking about it. And the more you talk about it, the more people that you are going to engage. And Jay just introduced me to this new website, and I mentioned it yesterday. It's where we live, and so we went to check it out. This bunch of ladies, and it wasn't open at the time. But I'm going to message them because part of their mission, part of their text or whatever on Facebook Live, talk about empowering, female empowerment and living your life to the fullest and being grateful for life and being grateful for what you have and not necessarily, being materialistic. And so I need to talk to these ladies, and so I'm going to reach out and post something on their page and introduce myself, and you just don't know who you're going to reach. And that's, I think along with getting your message out there, it's also you're fine-tuning what you're saying, and you're saying it again and again, day after day, which if someone's following you every day, I apologize if you get a little tired of hearing the same thing, but it's the message that you want to get out there. So we're changing the culture of the cancer-free population, and I'm very, very excited because I'm seeing little bits of light coming through this wall that we want to break down and serve this population of the Cancer Society and build a network of support and allow them to complete and to deal with issues and to find closure and to shut that door of that phase of your life and step over the threshold and grab onto your goals and your dreams, because you've been given this second chance. You've fought through adversity, and now you have the second chance to do anything that you want. So you have this fresh slate, and do it. Just go out there and, what did you dream? What did I dream when I graduated from high school? Well, now it's a lot longer than that. But, so I don't really care, about my age. It was very interesting because I've never really aged and years out of high school, and when when it's your birthday, people say, how old are you? And it's like I have to go, the 0 years are easy because they're big, they become bigger and bigger. But you just never know. And so I am 54 years old. I was diagnosed at 47. And every year that I have a birthday is a blessing, as someone once told me. It's a blessing because I am alive. And I am different. My family is different. My perspectives are different. I am so much more introspective, and I'd like to think patient, more patient and less judgmental. Those are challenges for me. But challenges are made to be overcome. So that is what I wanted to talk about today. I appreciate the couple of people that have logged in and said hello. This is getting exciting. If you see me kind of like trying to read, it's because the eyes are not good, and that's just my eyes. So I'll try not to squint too much in the future. But so I am going to tie it up and say I hope everyone has a wonderful afternoon and evening, that you are safe, that all is well. Tomorrow is Friday. I am off. Again, I work Saturday, so I will be on at 2:30 Eastern Standard Time, and that will be day 22 of my 90-day Facebook Live challenge for Champions Over Cancer. So please, if any of this conversation has touched you, or made you think of someone else, and it rings a bell, whatever, hit the link and join our page and start following us, because we're going to do great things, and this is just the beginning, because the future is bright, and I'm going to take advantage of every single bit of it, because there's no guarantees, and we all know that in this household. So that's it for today, and I will see you tomorrow, and I wish you all peace.